The only thing I can do is offer advice based on my own journey. Um, but what I will say is if you look at dentistry broadly, it's gone more towards medicine. You qualify after 5 years, you do your FD year, your foundation year, and then a lot of dentists want to jump on the bandwagon of becoming a specialist. And, they will start doing their core training year one, year two, trying to get a registrar post with an aim to becoming a specialist in a particular field. And I just think that it'd be nice if you actually spent a few years as a general dentist and you really explored different treatments and saw people with a broad range of conditions. It would really guide you to knowing actually what you felt you hated the most when you set off or finished dental school. You actually learned to love it over time because dentistry is very challenging. It's very challenging. And I'm a big believer that what you don't like first, you may learn to love later. I mean, broadly speaking, most dentists will say, hey, root canals are not for me. It's very tedious looking through a microscope, through my loops, can never get it right. Um, and a lot of people shy away from it. And then you get, the superheroes in dentistry that will then take a career in endodontics and they will do that for a living, which is all well and great. But I think that I sympathize with you guys because the problem really started when we entered dental school because it's a 5 year degree. And I think they should have taught us all a lot more, made us more equipped practically by the time we finished. 5 years is a long time, it's a big chunk of someone's life. And if you go and look at our predecessors, do some research, look back, go back maybe 50 years. Anybody who went to dental school for 3 to 5 years, when they qualified, for example, will have performed 200 extractions. You look at graduates today, doesn't matter whether it's Barts in London, doesn't matter whether it's King's, doesn't matter if it's Leeds, Sheffield, dental students are performing, if they're lucky, 10 to 20 extractions. Dentures, our predecessors would have made 50 plus. You're lucky if you've made three. Root canals performed 100 plus. Lucky if you've performed two, three. And I don't think that's good enough. I think, 5 years of dentistry, and largely speaking, it's a practical profession. There is a space for theory, but after 5 years, we're being pumped out as safe dentists. Um, and as a junior dentist, there's a huge amount to learn. There's a huge amount of experience to get. So ultimately, what's happened is that we've become de-skilled. We've become de-skilled as a whole. And then when you put into the pressurized environment of the NHS, which is your first step out of dental school or foundation training, it's too daunting. It's too much pressure. You want to get out of that system as soon as possible because you're sweating doing every single procedure. You're holding your breath, your heart's beating out your chest. And it's like, I've not done a crown prep, not enough to be comfortable with it. And what happened if I cut this tooth too much? The patient's nerve's going to devitalize and then they're going to complain and then I'm going to get sued and I'm going to lose my GDC registration. I don't think it's all that bad. I think just slow down. You need a good mentor. Write down on a piece of paper, those things that we don't like doing, those PDPs, those personal development portfolios, they really do help. Know your strengths, know your weaknesses, know yourself. You must work on yourself. Do not do dentistry for the purposes of money and greed or anything like that. Just love what you do and love yourself first and learn the areas you want to improve on. And just another word of advice, there's so many courses out there today. You've got all these dentists, celebrity dentists, they're all putting on these courses. And I'm afraid to say more than half of them are a waste of time. They're a waste of money. It's just marketing. For example, you walk onto a course, let's say it's a composite bonding course. Most dentists want to go on the course because they will learn how to do composite bonding. And ultimately, if you can't do it or feel more confident to do it, that course is essentially pointless. And I think that should be your measure across all courses. The best way to learn in our profession is to do more, practice, start with the basics. We all know the basic advice. You can get a plaster model, you can get a model, you can buy online, and you can sit there and you can apply composite to those acrylic teeth all day long in practice. And Please don't go and engage in advanced treatments. Don't come out of university thinking, right, I want to do porcelain veneers. There is so much to learn, and ultimately it will catch you out. And when it catches you out, it will affect your career, it'll affect your confidence. And to take dentistry to heights, you've got to be confident in what you do. And the only way you're going to be confident is by lots of practice. Yes, you'll make mistakes. We all make mistakes along the way. But if you just want to jump 10 years ahead, I don't think that's the way forward. I think you need to go at your own pace, and we're all different individuals. Please don't look at your best friend who went to dental school with you, who now's placing implants, and actually you're still struggling to remove a tooth. Don't. We're all unique individuals. We all have unique skills. We all excel in different areas. Just know yourself. Don't follow the majority. Follow your own career path and use a personal development portfolio and guide yourself and surround yourself with like-minded individuals, someone that can guide you, support you. As you step up and you take on tougher cases, have case-based discussions, plan the case, try and work out what the pitfalls potentially are. And very, very important, our GDC principles, our nine core principles, that's the holy grail, and they make sense. Every one of them makes sense. You should not work out your scope of practice. I mean, you wouldn't want anyone treating your mother or father if they don't have a clue what they're doing. It's quite simple. Um, don't take on advanced treatments if you don't feel comfortable in doing so. And don't feel like you're a bad dentist because someone else is doing all this advanced work and you're not. Everyone's time comes and it's unique to each person. Just enjoy yourself. There's plenty of pressures in our career. You all know that the suicide rates are high amongst dentists, and as you know, litigation is through the roof. And I think it's about time that we kind of stiffen up a little bit and just say, hey, this is what I can do. This is what I can't do. I'm going to enjoy myself. I'm not coming to work to suffer. And ultimately, I want to help people. I want to make a difference to people's lives, whether it's getting them out of pain or helping them smile or, providing a full mouth rehabilitation. And we'll all get there. It's a journey. It's not something that you can skip to Brazil and do a course and then start performing implants. So please be very, very careful. I mean, you probably know I've got a background in doing dental implants. I've got a background in performing surgical extractions and removing wisdom teeth and intravenous sedation, but it didn't come overnight. When I qualified, I spent the next 4 or 5 years in postgraduate training. I must have invested well over £300,000 into my personal education. And I can say, hands on heart, it paid off. It paid off. My colleague, yes, they went and became a dentist as soon as possible, tried to find the best private practice they can. Yeah, okay, they were earning a little bit more than me. They started to drive a nicer car. But I never got into dentistry for the money. I got into dentistry because I love dentistry. I want to learn. And I think that if you also think like that, you have every opportunity of excelling and becoming a fantastic clinician, a well-rounded individual. Try not to de-skill yourself too much because dentistry it's a specialist branch of medicine. And the more and more you sort of refine your practice, you're limited. You're limited in what you can do. Just becoming a private endodontist doesn't mean you've got bags and bags of patients coming in and you've got endless work. That's not the real world. Have a few strings to your bow and keep exploring and try not to shut the door on any facet of dentistry until you've spent enough time and you really know that, what, this is really not for me. Then fine, put it to a side. But until then, enjoy yourselves, keep making a difference, keep trying, keep working, keep going, keep pushing, keep helping people and keep smiling. And if you're really suffering and you think that it's got under your skin, then take a break. Take a break. Just fly out. You can do it. You can do it. You're so fortunate. Majority of your dentists are so fortunate that if you wanted, you can work 3 days a week, 2 days a week. Not everybody has that benefit. And I think that's one of the best benefits of being a general dentist. Don't sign up to more than you can do. Take it easy, enjoy yourself, learn, love yourself, love your life, love your patients. You'll do way better.